Hello everyone, my name is Zhang Lingtao and I come from Beijing Academy in China. Today's topic is about phenylketonuria, also called PKU. PKU is a genetic disorder caused by mutations in the gene encoding phenylalanine hydroxylase, PAH, and it can result in an accumulation of phenylalanine, also called Phe, in the body. When the gene encoding PAH is mutated, it cannot convert Phe into tyrosine. While an excess of Phe accumulates in the body, it will lead to brain damage and other hazards. PKU has been reported in over 60 countries. Worldwide, PKU has an estimated prevalence of 1 in 24,000 live births and affects about 0.45 million individuals. The prevalence of PKU varies greatly according to the region. PKU is a recessive autosomal genetic disease that is inherited within families. Since each chromosome is passed down to a child in 2 copies, one from the mother and another from the father, the child has 100% PKU if both parents have it. If only one parent has PKU and another is an unaffected carrier, the child has a 50% chance to get it. If both parents are carriers, the child has a 25% chance to have PKU. Based on the blood Phe level, there are generally 3 types of PKU: mild hyperphenylalaninemia PKU, mild PKU, and classical PKU. The Phe level range is listed in the table, and from the table we can see the highest incidence is CPKU, which is the most severe type, so it must be taken seriously. In addition, the distribution and severity vary greatly according to the different countries and regions. If detected early and treated, people with PKU have almost no symptoms. Otherwise, PKU can damage the brain and nerves, leading to cognitive impairment. The classical symptoms for PKU are eczema, a lighter color of skin and hair compared to other family members, a small head, and a red odor in the breath, skin, or urine. Severe symptoms include behavioral problems such as irritability, hyperactivity, poor self-esteem, developmental delay, and intellectual disabilities. Newborn blood screening is the main means of detecting PKU. It can almost diagnose all cases of PAH deficiency. Normally, newborn screening is done by having a few drops of blood taken from his or her heel after 24 hours but before 72 hours of birth, and analyzing the Phe levels in the blood. If the blood Phe level is higher than 242 micromoles per liter, the baby should be considered to have PKU. 1% of tested infants have positive results during the first screening, but only 10% of them have PKU. If the initial tests show a positive result, the infant's blood sample should be sent to a referral metabolic center to do the confirmatory test. Population screening for PKU began in 1960s after the Gathering test. Population screening for PKU began in 1960s after the Gathering test was invented. Over the past half-century, laboratory screening techniques have been developed continually. These advancements have led to more accurate newborn screening for PKU. In this table, the detection techniques are compared in different dimensions. The most current state-of-the-art technology is tandem mass spectrometry for its high sensitivity, specificity, and coverage range. However, it is the most complex one. That's why the Gathering test is still used today, because it's low cost and requires no complex instrumentation or equipment. The genetic test is used to detect PKU carriers by looking for variants in the PAH genes, which has been used in recent years to diagnose the PKU. The doctors will take a sample of amniotic fluid from the mother's uterus to test for mutations in PAH. It is strongly advised to conduct a carrier screening if one of the parents carries the PKU gene. However, parents should consider this carefully and go to a genetic consultant since the procedures have risks. A low-protein diet is the main therapy for PKU patients. Reduce about 75% or more of your protein intake to maintain the blood Phe level. Patients should eliminate high-protein foods like eggs, milk, cheese, nuts, and fish, and control their intake of bread, rice, pasta, and some vegetables. Based on their individual tolerance, each PKU patient should be given a daily dose of Phe. The PKU formula is an amino acid-based powder that can provide daily nutrition for PKU patients. The recommended daily dose for formula should be under the direction of a healthcare professional. For infants, a Phe-free infant formula will take the place of the standard one. The main PKU symptoms can be prevented with low-protein diets. However, only a tiny percentage of treated people can maintain optimal blood Phe levels with food therapy alone. Under most conditions, the dietary treatment should be combined with medication. Kuvan is first approved prescription medication for PKU. The active component in Kuvan is BH4. It is a natural substance found in the body that can help the PAH enzyme reduce Phe. Recommend treating PKU patients with Kuvan if their blood Phe level greater than 360 micromoles per liter. However, only 20 to 50% of patients benefit from Kuvan. The most frequently reported side effects are listed here. Kuvan is not a cure. Palynziq is a pegylated PAL enzyme that can reduce blood Phe levels by converting the Phe to ammonia and tranexamic acids. Palynziq is used to treat adult patients with uncontrolled PKU with Phe levels over 600 micromoles per liter. It requires daily injections. The most frequently reported side effects are listed here. Palynziq is also not a cure like Kuvan. Since both dietary treatment and medication are not cures, several innovative new gene therapies are under development. Gene therapy aims to restore liver PAH expression. In gene therapy, the genetic material from outside the body needs to get inside the cell nucleus via vectors, recombinant viral vectors or non-viral vectors. The primary approaches are messenger RNA therapy, gene addition, and gene editing. The table shows several gene therapies in development of PKU. All of them use viral vectors. HMI-102, developed by Homology. The table shows several gene therapies in development of PKU. All of them use viral vectors. HMI-102, developed by the Homology Medicines, uses adeno-associated viral vectors. AAVHSC15 and is in phase 2 clinical trials. BMN307 is developed by the BioMarin and uses AAV vectors. AAV5 is no clinical hold by the FDA temporarily due to liver cancer observed in mice. AGT's PKU gene therapy uses a lentiviral viral vector and is in clinical study. By now, all these gene therapies have no published data. Thank you for listening. If you have any question about this presentation, please feel free to contact with me. Thank you again. Bye.